Hello, we're rolling into another episode of the DRH show. As usual, I talk to interesting people within psychology, mental health, and well-being. Today, I'm joined by a clinical psychologist. In particular, he specializes in helping people face their social fears and anxiety disorders. Dr. Eric Goodman, thanks for joining me.
Thank you. Happy to be here.
It's great to have you here, Dr. Goodman. So let's start off with you telling us your background, your trajectory in life, and how you ended up doing what you're doing.
Well, I'm a clinical psychologist, and after grad school, I was looking for my first job, and anxiety wasn't really on my radar, but there was an opening for an anxiety specialist, and I had a lot of training in what's called cognitive behavioral therapy. And so they offered me a job as an anxiety specialist, and I took it, and I just kind of fell in love with it over the years. And, after a few years, I decided that's the only thing I ever want to do is help people who are dealing with anxiety limiting their life and helping them to get free to kind of go and live the life they'd like to live.
And of course, your role as a clinical psychologist, and especially for someone who specializes in anxiety disorders, it's becoming more relevant now during COVID-19 and in relation to the lockdown that a lot of countries are experiencing. So can you please tell us how COVID-19 is impacting people with anxiety disorders?
Well, so I've seen it do a couple of things. For some of my clients with, say, social anxiety, or people who with claustrophobia who are afraid to leave their comfort zones, the pandemic has actually been something that has been a relief for them in the sense, not in the sense that it's a happy occasion, but there's less pressure for them to leave their home, connect with other people face to face, and they have found it actually their anxiety is surprisingly quite a bit lower. Other people, on the other hand, with say obsessive compulsive disorder, with contamination concern, and generalized anxiety disorder, I've seen their anxiety levels just go through the roof. Really some of the most severe exacerbations of anxiety I've seen in my career. COVID is many different things, but one of the things that kind of defines it is uncertainty, right? We don't know exactly what's going on, right? Researchers, doctors are really trying to figure it out. So it's scary, and we don't know when it's going to be normal, whatever that's going to be. Again, we don't know when the vaccine is coming, if the vaccine is coming, and if so, how much is that going to help? So that's a recipe for tremendously exacerbated anxiety for all of us. And then if you have somebody who is phobic of uncertainty, as people with, say, generalized anxiety disorder are, where they normally have a difficult time tolerating anything that's unclear, uncertain. This is really, as one person told me this week, this is their absolute worst possible nightmare come true. So I've seen quite a range.
So if we could expand on that, could you give us some recommendations for people experiencing anxiety during this crisis? What should they look after?
Well, so we want to understand, if you're not feeling at least a little bit anxious during COVID-19, something isn't functioning right. This is a scary situation. Now, the statistics are the statistics, right? A lot of people are getting sick, a lot of people are dying, but most people won't, right? So an individual risk is pretty low, but it's not zero. So it's a scary thing, and We need to think in terms of, number one, normalizing anxiety, right? That this is what uncertainty feels like for most people, and actually, I think it's a way that people without anxiety disorders can understand what life has always been like for someone with an anxiety disorder. So
Mhm.
we're all kind of feeling it now, but people with anxiety disorders have been feeling this way for a long time. And we kind of can get it now, that uncertainty does not feel good.
Mhm.
But we want to understand that anxiety itself is not harmful. It's not something that is, it's not a disease or a disorder in and of itself. Anxiety is our body's natural way of trying to protect us from threats by
Mhm.
triggering fight or flight response. It's just very glitchy, our anxiety. It wants to protect us from kind of prehistoric threats. Animals out on the Serengeti that are coming after us. Anxiety is in its element when something is known and it's imminent and we're aware of it. Anxiety kind of does the right thing. In modern times, it gets very confused. It doesn't understand this whole invisible threat sort of thing,
Mhm.
and so it's in us telling us, defeat the threat, when it's nothing that's within our power right now. Although, if anxiety motivates us to social distance, if it motivates us to wash our hands, if it
Mhm.
motivates us to take basic safety precautions, then it is actually performing a very useful service for us.
Mhm. Mhm. That actually reminds me of an earlier interview that I've carried out for some of my listeners. They probably, or some of my listeners of US, they've probably seen my interview with Dr. Halterhoff. He's a lecturer from University of Edinburgh, and he mentioned something about death anxiety in relation to coronavirus. And it kind of, echoes what you've just mentioned, that when we're anxious, it motivates us to look after ourselves, to wash our hands, and, not to spread the virus further. And I think that's the thing about, anxiety, that it prompts us to reshape our behavior. So in essence, it's, improving our well-being, and whether physically or mentally. Now, what I'd like to touch upon this time, Mr. Dr. Goodman, I'm sorry, is could you tell us what are the implications of ending quarantine for people with anxiety disorders? Of course, we can for the meantime, we can forget about, whether the argument whether we should continue to, observe the lockdown, because there are some groups who say that, we should end the lockdown, and some groups that say that, no, we should carry on with the lockdown. But
Right.
in relation to, the clinical aspect, the psychological aspect, what would be the implications if we cut it short?
Well, it's actually pretty complex.
Mm-hmm.
So if you get somebody with an anxiety disorder who's at home, they're not able to work, they're not able to, provide adequate food for their family, that's going to be incredibly anxiety provoking.
Mm-hmm.
And a lot of people, I think about my mom in particular, who's been kind of secluded alone in an apartment for the last 2 months, and the mental health implications for a lot of people who are kind of getting cabin fever at this time, is pretty. It's hard to overstate that.
Mm-hmm.
We are absolutely not designed for quarantine as a species. We're designed as humans are herd animals. We're pack animals.
Mm-hmm.
And what happens in prehistoric times to the animal that's isolated out in the wild, right? They don't make it. And so we're designed to be pretty uncomfortable, pretty anxious when we are isolated. And this, couple of months of isolation has really been a challenge for a lot of people. And so, on that respect, loosening quarantine might be beneficial. for some people in some situations.
Mm.
But then you have kind of people who are going to be more encouraged or even forced to get back out into the world that is very uncertain and kind of scary right now. I think about my clients with social anxiety disorder who are really phobic of assertiveness. Assertiveness right now is a life or death skill as we venture out of quarantine, because there are people who are not going to take the pandemic seriously. They're not able to really kind of grasp that there is an actual danger. And so people won't wear masks, they'll stand close to you. And they may even mock or belittle people who are taking reasonable, good safety precautions. And so being able to speak up assertively and saying, look, I'm social distancing, please, give me some space. Again, it could be a real life or death sort of skill right now that for people with social anxiety disorder can be a tremendous hurdle. And so I'm encouraging people to, obviously be assertive, stand up for yourself, state what you need clearly, and feel that anxiety. Right? It's the thing about anxiety, people often take it as a sign, this is uncomfortable, I shouldn't do it. And we want to understand when you do something and you're feeling anxious, your anxiety is learning something, right? And so if you want your anxiety to be less reactive to assertiveness, for example, avoiding assertiveness is never going to do it, right? So you have to bring your anxiety with you, be assertive, feel the anxiety, don't fight it, don't struggle with it, but just let it be, hold it gently, and then see for yourself that it's okay, that it's unpleasant, but it's tolerable. And over time, as you present your anxiety with assertive situations that go, good enough, your anxiety will learn and it will start to scream less loudly in future situations.
Now, I'd like to step back. Earlier, you kind of alluded the difference between anxiety and anxiety disorder, but if you could just discuss that to us, especially for those who's not familiar about the distinction between these two.
Right. Okay. It's an important distinction to make. So anxiety is normal. Anxiety is something that all, healthy functioning humans experience on a pretty intermittent basis. When we do things that we care about, we could fail and we could lose, and that's a threat, and there will be anxiety. And so if you have a big job interview and you really want that job, and you've been studying in college for 4 years, and that's your dream job, your anxiety is going to be there. It's going to speak up and try to protect you from that failing, or might even protect you from even going and taking that risk. But anxiety is going to be there. And so if we go after things in life that are important to us, career and friendships, romantic relationships, anxiety is going to be there, right? It's a sign that you're living your life. What happens with an anxiety disorder, however, is people begin to fight their anxiety. They begin to avoid things that make them uncomfortable, or they enter those situations that make them uncomfortable, and they do all kinds of safety behaviors. So they get on the airplane and kind of white knuckle and pray and try to imagine that they're not on an airplane. And all those things send signal to anxiety that, yes, flying is a threat. So keep up that adrenaline because I need it, right? When we are feeling anxious, you can kind of think about anxiety is like a 3-year-old with a clipboard that's taking notes. Is this dangerous? Is this not dangerous? And it's watching you. And if you react as if the anxiety itself or the situation itself is a threat, it's going to note that and it's going to howl even louder the next time. But if you treat the situation like it's not a threat, if you hold the anxiety softly, if you're willing for it to be uncomfortable for that time and move forward anyways, and nothing awful happens, anxiety will learn over time. It doesn't learn quickly, it doesn't learn efficiently, but it does learn.
So right now, well, if you're terrified of contracting coronavirus, that's not an anxiety disorder, that's just anxiety.
That's right.
Yeah.
That's right.
Okay.
Absolutely.
And I suppose you often get asked this as a clinical psychologist whose expertise lies within anxiety. People are asking, so can anxiety be cured?
Well, so the answer is no, in the sense that anxiety as an emotion itself is normal, protective. And without anxiety, we're going to be either dead or disabled. Because, you know, if you're driving on the highway and a car in front of you slams on its brakes, you need to have a massive sudden panic reaction so that your brain and your body works much quicker than it normally would work. And if you're kind of lackadaisical, you're going to smash right into the car. So we need to have it. In fact, there's research with a woman whose initials go by SM. You can Google this person. She's known as the woman without fear, and she has this genetic disease that she was born with, that when she turned, I think at 12, 13, 14, her amygdala, kind of the parts of the brain where anxiety lived, calcified. And she lost the ability to be afraid of things out in her environment. And she's been heavily researched to see kind of what's anxiety, or what's life like for somebody who really can't feel anxiety. And she's had all kinds of problems. That you know, she'll go to a park late at night, and if there's some sketchy person says, "Hey, come over here," and she'll say, "Okay," and she'll come up to him, and person held a knife to her neck and said, I'm gonna kill you," and she said, "Okay." No fear whatsoever. And then most of us, if we're in a traumatic situation like that, our anxiety learns, and the next day we're not going back into that park late at night again, but she goes back time and time and time again, because she's not learning on a emotional level that this is a dangerous thing. So yeah, she's had all kinds of difficulties. Yet at the same time, she's had a very peaceful life, because, you know, someone holds a knife to her, she doesn't feel, she can feel some excitement, but she doesn't feel fear. But for the rest of us, anxiety isn't going anywhere. And so we have a choice. We can hate it, we can fight it, we can demonize it, and then we can suffer and have anxiety about our anxiety, or we can try to make peace with it. And when it shows up, don't look at it like a demon or a monster, but look at it as, here's something that cares about me. It's trying to help. It doesn't understand that this situation is safe. Let me proceed into that situation and show it that it's safe. And so we want to treat anxiety as a willing inner companion that's going to show up sometimes. We soothe it where we can, we teach it where we can, and we accept it otherwise. Because the alternative of looking at it like an enemy only leads to more anxiety and more suffering.
I liked what you said. Just take it like as if it's a companion, you know. So I suppose from a clinical psychology standpoint, what we're actually doing with anxiety is managing it, and we're not really, the end goal is not really eliminating it totally. Now, the reason why I invited you to speak here at the DRH show, Dr. Goodman, is I stumbled upon your book. So if you could just tell us about your book.
Well, the book is Your Anxiety Beast in You, a compassionate guide for living in an increasingly anxious world. And actually, even before COVID-19, we have been getting more and more anxious as a species. Anxiety levels have been rising. And that's likely due to things like, 24-hour news and social media and just the complexity of modern life. And anxiety, again, is stuck in prehistoric times, right? It doesn't understand that when we're watching something in our home in the evening, that something awful that's going on somewhere else in the world, it doesn't really understand that that's not a threat to us. And so life is just much more anxiety producing. There's a lot of books and blogs and gurus that talk in terms of how to cure your anxiety in 10 easy steps, how to overcome your anxiety. Anxiety is the bully, it's the monster, things like that. And it sets this expectation that anxiety is an antagonist. It's something that we either have to begrudgingly live with and kind of, yeah, it's there in my head and I can't do anything about it, or we're going to fight it and hate it. And when we understand that anxiety really is just an inner bodyguard, that's all anxiety is. It's always trying to help. It just is completely baffled by modern life. If we look at it again as a companion, as something to teach and to soothe, then we're going to have less suffering in life, as opposed to if we set a goal of I'm going to be anxiety free, I'm not going to be anxious anymore. Well, that's not realistic. Or you can have very minimal anxiety by living in your parents' basement for life and never breaching the doorway and going out into the world of work and career and love and friendship. Because if you leave and venture out into the bigger world, anxiety is going to be there.
Mhm. You have a rather interesting premise on your book. You talk about compassionate approach to anxiety, and I have to be honest, this is rather different. This moves away from the usual narrative on how to approach anxiety. But Dr. Goodman, what exactly do we mean when we say we need to have a compassionate approach to anxiety? And could you also talk about the advantage of this particular approach?
Right. So when we understand that anxiety-free is it's a marketing buzzword, it's not real. There's no studies that show that we take your anxiety from a clinical level to zero. Right. That doesn't exist. We can with good interventions, right? We can do a lot. There's a lot clinical psychology can do to help people with anxiety disorders, but we don't cure a normal emotion, right? And so that's important to understand, that no matter what you do, what guru you follow, anxiety is going to be part of life. And so again, we can choose to make it worse by hating, fighting, and struggling with it, or we can look at it through a compassionate lens and we can help to soothe it. We're designed as a species to be soothed by compassion. So, if you think about prehistoric people venture out into the dangerous world of hunting and gathering, being chased by saber-toothed tigers, at the end of the day, making it back to their tribe, small band of 50 to 100, 200 people, where they were soothed through compassionate connection, right? So we're kind of wired to be soothed in that way. And there's a lot of research out there that shows if we can increase people's self-compassion, there's less depression, anxiety is quieter, and a sense of well-being increases in life. And so I think about it from a very pragmatic way. If anxiety is ultimately going to be a reality of life, and there is nothing that we can do if we want to be out into the world, living our life and doing things of value, anxiety is going to be there. We can make it worse, or we can help soothe it and teach it. And so the more compassionate, gentle way I think is just much more pragmatic and effective.
Would it be right for me to say that that kind of approach also ties in with promoting resilience? Because by being compassionate with anxiety, in a way, we're not really resisting it. And as a result of that, we're promoting resilience and other skills. Would it be right to assume that?
Yeah, absolutely. I think kind of increasing our willingness to feel emotions is a resilience skill. We know that emotion suppression, trying to push away emotions, trying to kind of fight against them, is only things that tend to make us suffer in the long term. So even if it helps in the short term, so if I have 5 shots of vodka before doing an interview, right? I might be more physically comfortable in the short term, but in the long term, I'm continuing to reinforce this message that interviews are a threat and I shouldn't do them, and this is going to be humiliating and catastrophic. Does that make sense?
Yeah, absolutely. Now, Dr. Goodman, could you also talk to us the difference between cognitive restructuring and diffusion, and when would you actually use each of these approach?
Yeah, so I think about anxiety and how it impacts 2 different parts of the brain. So we have the prefrontal cortex, which is kind of this new part of the brain, the top part of the brain. That's the thing that really separates us from other animals. That we have this really complex prefrontal cortex that allows for logic and reasoning, language, and all that good stuff. And then we have this lower part of our brain, they call it the mammalian part of our brain, where we have these 2 almond-shaped structures, and that's where anxiety lives in our amygdala. And those both, I believe, benefit from a couple of different types of interventions. So if we truly believe that something is dangerous, then and we're incorrect on that. So if I take me, I used to have a horrific phobia of flying on airplanes. And at age 19, I really believed that flying was a dangerous thing. I could not wrap my head around how oxygen, could hold up a multi-ton vehicle at 30,000 feet. That just made no sense to me. And so for me then to do some cognitive restructuring, to actually find some facts on flying and understand it's actually the far safest way to travel, that you have to fly every day for 16,000 years before you're going to be in a fatal plane crash, statistically speaking. That helped me logically say, all right, it's only fear then that's holding me back. I'm not actually in danger. I'm going to go get on the airplane. Well, once I'm on the airplane and we hit turbulence, well, my amygdala says you're going to fall out of the sky. Now, I didn't believe that logically, but the lower part of my brain absolutely 100% believed I was going to die with turbulence. That's where doing what they call diffusion can come in handy. So instead of, when my brain says, the plane's going down, do something, and I grip the armrest and try to get certainty that the plane, an impossible feat to get certainty that the plane's not going to crash, which only made me feel worse. Being able to go, oh yeah, anxiety's trying to help me now. Thanks, dude, but I'm okay, right? This is okay. So it's not cognitive restructuring. It's not actually kind of sinking into a level of it's like trying to debate a 3-year-old. When you try cognitive restructuring with the amygdala, you're having a logical debate with a 3-year-old. And if you know anything about 3-year-olds, you can't win a debate based on logic with them. It doesn't work. And so being able to just notice, yeah, my anxiety is really acting up. I'm aware of my anxiety right now. Hello, anxiety, and kind of refocus on what's truly important to me, which is going to visit family or friends or going to a conference or something like that. That, I believe, is a much more effective approach than cognitive restructuring. Cognitive restructuring, though, got me on the airplane, so that was good also.
Now, if you could take us back to the premise of your book, because the way I understand it is what you're saying is the end goal of anxiety is not really to become, the end goal of anxiety treatment is not really to become anxiety free. So what is the end goal actually?
Well, the end goal ultimately is to reduce suffering. Mm-hmm. And to venture out into the world based on what's important to you, what your value system is, mm-hmm. Not live your life based on kind of your inner 3-year-old bodyguard setting these limits. Don't go date because it's too uncomfortable. Wait till, anxiety will say, wait till you're comfortable, mm-hmm. then go date. But that doesn't work. You'll never be comfortable until after you've done it repeatedly, right? And so the ultimate goal is freedom, is being able to go and live your life, get outside your comfort zones, and then at the same time, create a soothing environment for your anxiety to live. So anxiety lives within our nervous system. So if we have a nervous system that is fueled by caffeine, if it's fueled by lack of sleep, if it's fueled by a sedentary lifestyle, if it's fueled by a poor diet, our anxiety is going to live in a very antagonizing environment within our nervous system, and it's going to howl louder. So one poor night's sleep is going to crank up the volume on your anxiety 30% on average. And so we want to make a good home for anxiety. We're soothing it where we can, but then we're always going back to what is a value-driven behavior, right? What do I want to do? What's important to me? And then we do that. We bring anxiety with us to show it that this prehistoric fear that it has doesn't come true. And over time, it can begin to learn. And so pre-pandemic at least, I flew very comfortably for many years, mm-hmm. but that was after, 10, 12 years of absolute panic on airplanes. So our anxiety can learn, but it's not an efficient learner. It's a very slow learner of safety. It actually learns danger very well. It learns safety very poorly, very slowly. So that's where we just want to think in terms of, if anxiety is part of life and I have to bring it with me, let me teach it. Let me train it like you would train a shelter dog that you adopt, right? It can learn a lot. It's never going to learn to sit at the table and eat with a fork and a knife, but it can learn a lot. And so if we're having this compassionate, more productive relationship with our anxiety, we're taking an active role in giving it a good home and teaching it, life is going to be better than if we think about anxiety as our enemy and we set a goal, we buy into those marketing buzzwords of anxiety free, and then we fail because there is no permanent anxiety free outside of death.
Mm-hmm. And could you also talk to us, what does it mean to train your anxiety?
Well, so we train our anxiety through experience. Mm-hmm. So what we'd like to have work is logic and reason. We'd like to tell our anxiety that flying is perfectly safe, don't worry about it, or public speaking is perfectly safe, don't worry about it. Mm-hmm. It just doesn't work because anxiety doesn't live in this logic part of the brain. If it did, then I have a completely different book. Anxiety is in this lower part that learns best through experience. And so again, if we're avoiding things that are uncomfortable to us, we're missing these teachable moments that anxiety needs to learn how to live better in the modern world.
And could you also talk to us what is inhibitory learning approach?
Okay, so so this is a little bit more psychology, nerdy sorts of stuff.
We'd love that stuff.
Oh, okay, all right. So traditionally, though, so the way I was taught to do exposure therapy many years ago was that you find out what someone's afraid of, and you develop a hierarchy. So if somebody's afraid of heights, for example, you would take them to the first floor of a building and wait, take them to the second floor and wait, third floor, and so on and so forth up this hierarchy. And it's counting on the body's natural ability to habituate given enough time in a situation where nothing bad happens. The body eventually gets used to it. The problem with that is more recent research has shown that whether we habituate, that doesn't really it doesn't really have implications for long-term outcomes. And so if I do exposure therapy where I go to the fifth floor and I sit there and I wait an hour until my body gets used to it, and then I come back next week, it doesn't necessarily mean my anxiety has learned. Anxiety, again, it's a very poor learner. And the other problem with anxiety is it forgets very quickly. And so that's one of the problems with this pandemic quarantine is over time, when you're not reinforcing what you've taught your anxiety, it can forget and go back to the old learning. Danger learning, so this is kind of the bad news, is once we have something phobic in our brain, we have this phobic neural pathway, that's forever. There's no technology to delete something within the nervous system once it's been created. So we can add, but we can't delete. And so fears are forever. I will always have a phobia of flying on airplanes because you can't undo a neural pathway that's been done. But what I can do is I can teach anxiety on a much deeper level that that flying is safe. And so then you have two neural pathways kind of competing. You have the one that says flying is safe and the one that says that flying is dangerous. The stronger pathway is going to inhibit the weaker pathway. And so if I believe, this much that flying is safe and this much that flying is dangerous, this flying is dangerous thing is going to be muted tremendously. We can't get rid of it, but we can inhibit it. And so we want to do things to maximize anxiety's learning. So instead of following up a hierarchy, for example, they've found that if you skip around kind of an exposure menu of many different things that are triggering, and you don't always go for the easiest and then work up, you might sometimes pick an item that's higher up, sometimes pick a medium one, sometimes pick a lower one. And I think it's because life kind of throws triggers at us in fairly random sorts of ways. Life isn't going to throw us triggers in this kind of neat sort of way. So we want to take these steps to maximize how well anxiety learns safety, so that the danger learning is as weak as can be.
Mm-hmm. Thank you. And I always ask this question to my guests: what's one thing about psychology that you think we should talk more about?
For me, clearly it's that anxiety is normal, and that if you buy into these messages that anxiety-free is an option and it's something you should go after, you're going to feel like you fail when an anxiety inevitably rears its head time and time again. And so I would love for psychology to stop using metaphors that are that paint anxiety as a bully, a demon, an antagonist, an opponent, as so many people do, because after treatment's done, you're still left with that thing in your head. And that doesn't feel good, as opposed to considering that this thing in your head is actually something that cares about you and wants to help. So, and even with, I call anxiety a beast, an anxiety beast, but it's taken from the fairy tale Beauty and the Beast, right? How the beast on superficial glance seems like a monster, seems like a villain, but it's just misunderstood. And after a while, you come to see that the beast is actually the hero. And when I think about the anxiety beast, that's what I'm thinking about. I'm thinking about it as being misunderstood. And so that's my hope.
Mm-hmm. And I just came with this question because you're talking about training your anxiety and compassionate approach to managing anxiety. As a clinical psychologist, would you recommend that we switch off from watching news? Because I have to be honest with you, I'm a news guy. I always watch news every 6 in the evening. But for the past 2 months, I switch off news. I just glance through the headline on major news websites, but I don't watch the news anymore. Would that be a right approach in relation to managing anxiety, training anxiety? Would you say so?
Well, so again, there's some complexity to this, because if there was no danger whatsoever, then I would say absolutely, just don't turn on the news for the next few months. But the challenge is that there is risk, there is danger, and we do need news more than ever as a way of being informed of what behaviors should we be doing, what behaviors should we not be doing. It's playing a vital role in the world right now. And so what I would say is absolutely limit your news tremendously. The people, in my experience, who are having the absolute worst time coping with the pandemic are people who are sitting at home with the news going 24/7. Because the news ultimately, it wants you to click back in, so it does tend to present things in a very provocative sort of way. So we need to pick our news sources that are trustworthy, more fact-based than opinion-based. And we need to, capture in maybe, 10 minutes a day, maybe a little bit more, maybe a little bit less. What do I need to be doing practically to stay safe and to keep my family safe? And so, yeah, I would encourage you, watch some news, but don't overdo it.
I think that's a lovely message. Dr. Goodman, your approach to anxiety is rather unique. Unique from my ear, because I've never heard that before. Because it's always the approach to anxiety that I often hear is we try to to deal with it, but yours is be compassionate about anxiety. So I was wondering if there's a particular book or is there a particular individual that influenced your thinking?
Well, yeah. So I'm influenced by kind of three different things. First is cognitive behavioral therapy. I'm a CBT person from many years back. That was just most of my training and supervision, going way back. But the problem with kind of old school cognitive behavioral therapy was the focus was on just symptom reduction. And the problem is you don't eradicate an emotion, and so you're left with something, right? You're always left with something. And then I got into Stephen Hayes' work with acceptance and commitment therapy, and they talk in terms of a lot of what I speak of: diffusion, acceptance, willingness. Understanding that emotions are normal, they're intense at times, and the reality is life really hurts at times. And we can pretend that that's not the case, and we can write fairy tales about anxiety-free and pain-free and things like that. But but it's not real. Life absolutely hurts at times. And so acceptance commitment therapy is just an absolutely wonderful approach for helping people deal with the reality of pain in life. But even with acceptance commitment therapy, they very often use the language of demonizing, literally demonizing anxiety.
Mm-hmm.
And so then it was actually a UK psychologist that really kind of transformed how I look at things. Dr. Paul Gilbert, who is a psychologist and founder of compassion-focused therapy.
Mm-hmm.
And compassion-focused therapy for me was again another game changer. My book kind of integrates CBT with acceptance commitment therapy and compassion-focused therapy. And what compassion-focused therapy talks about is, we were kind of born into this system that kind of these glitchy brains that we didn't get to pick, we didn't get to choose, we don't get to pick our temperaments, we didn't get to pick our parents or our upbringing, traumatic things that happened to us, and we don't get to pick the fact that we have a finite amount of days until we die. And that we, unlike other animals, are well aware of that. So it's a challenge. And so compassion-focused therapy talks in terms of life is going to be hard at times. So treat yourself with compassion, because compassion is designed to be soothing as opposed to fight or kind of drive to accumulate more and more and more in life. All those things kind of ramp the nervous system up, whereas compassion tends to soothe us for evolutionary reasons. And so I love the fact that we get to be imperfect, we get to be glitchy, we get to make mistakes, and it's not our fault, it's not our choice, and we don't have to beat ourselves up for being human anymore. And that's a game changer for me.
You clearly devoted a lot of your time and energy on exploring ways to effectively manage anxiety. But if there's one thing that the public would, if there's one thing that you would like the public to know about your work, what's the most important thing that we should know about your area of expertise?
Well, I would think in terms of changing the mindset about anxiety. If anxiety is your enemy, it's louder and you suffer more. If anxiety is your glitchy inner companion, and it is really glitchy, right? But it means well. It's not trying to torture us. And so if we can see anxiety as something that means well, it's trying to help, it's like a 3-year-old, logic-wise. And we want to give it a soothing home, give it a good home, and we want to teach it where we can. I think that's a good way to think about it.
And what other interests do you have other than psychology? What's your sort of distressing outlet?
Well, a couple of things. Pre-pandemic, I had gotten very much into virtual reality, and again, that's psychology, but using virtual reality to help people face their fears has been something that's just been uniquely fun for me, at least, and my clients like it too. I can have them in my office and put them on a skyscraper, and with the system that I have, it feels incredibly real to them. And that's I think where incorporating technology in the field, I think is going to be pretty big. But outside of professional stuff, I'm quarantined at home with my wife and 3 kids, and have actually enjoyed spending a lot more time with them. And cooking. Cooking is, for me, is kind of a form of meditation. It's a form of art. I have had a lot of fun watching YouTube videos of different sorts of things and trying to recreate that in my own imperfect way.
Brilliant. And finally, Dr. Goodman, can you tell us where we can find more about you? Where are you available on social media to be followed? And also, where can we buy your book?
So the book is available on Amazon, and hopefully someday when the world opens up in bookstores. But right now it can be found on Amazon. And I'm on Twitter at Dr. Eric Goodman, EricGoodman.
I'll definitely put that on the description box so everyone can follow you.
Fantastic. Thank you.
And also, do you have any upcoming webinars? Because a lot of psychologists and a lot of academics seem to be doing a lot of these webinars since the lockdown.
I've been doing a lot of writing and interviews like this. I have not created a webinar. I'm going to be teaching a graduate class in the fall, and the webinar I'm going to need to make is going to be having a 10-week class online. I've never taught virtually before, so that's got my anxiety waking up, and I'm going to bring it with me and show it that teaching online isn't a horribly scary thing to do.
Brilliant. Okay, on that note, Dr. Goodman, it's time to wrap up. It's been an insightful conversation with you, and thank you for sharing your time and expertise. I look forward to hearing more about your work.
Thank you. It's been a pleasure.